Good evening and welcome to In the Public Interest, Connecting Healthy Communities with Capital Health. I'm your host, Zachary Chester, and you are listening to us live on WIMG 1300. On the internet, we can be heard www.wimg1300.com. If you are viewing us, you're watching us on WZBN Mercer TV 25. Joining me tonight is my guest, Dr. Michael Cohen, on staff at Capital Health. Welcome.
Thank you very much for having me.
Dr. Cohen, we want to get right into it. This is a very, very important topic that we're going to be discussing tonight. And being that I turned 40 last month on May 4th, tonight we're going to be talking about prostate cancer awareness, or prostate awareness, because that's what this month is. Dr. Cohen, why is prostate cancer receiving so much attention?
Well, first, again, thank you very much for having me. It's a pleasure to be here. Again, just to highlight some of the things that are ongoing right now, it's Men's Health Week coming up, and that's June 15th through the 21st. And with Men's Health Week, obviously, one of the main things that we want to inform the community about is prostate cancer and prostate health and other conditions, not necessarily just prostate cancer.
Yes.
And so one of the reasons why it's receiving a lot of attention lately is, number one, that prostate cancer, like breast cancer, is very common.
Okay.
And many men end up having prostate cancer, in particular in the African American community. So we, as Capital Health, we offer a lot of prostate cancer screening to the community, and we'd like to get more awareness about prostate cancer to inform the community, to give them education and health screening and treatment options if needed.
Okay. And what's the average age men are diagnosed with prostate cancer?
You know, initially, quite a number of years ago, before the advent of PSA, or prostate-specific antigen, which is a blood test that we use now, patients were usually diagnosed at advanced stages of diseases. So they were more diagnosed in their 70s. Now, with prostate cancer screening, patients are diagnosed a lot sooner. So they're being diagnosed in their 40s and 50s and 60s as opposed to in their 70s. The good part about this is that although they're being diagnosed at a younger age, they're being diagnosed at a lower stage of disease. So where it's treatable and not where it's spread outside of the prostate.
Okay, so for myself, like I mentioned earlier, you know,
Happy birthday, by the way.
Right, just turned 40, so when I go in for my annual physical, you know, is this something that my primary care physician would just automatically, you know, say I should be tested, or should I ask?
If they don't mention it, it's something that you should ask about. Typical recommendations, and there's no doubt that there's been a lot of publicity also about prostate cancer screening and the debate and controversies about it. With that being said, some of the new recommendations are to at least get a baseline PSA starting at the age of 40.
Okay.
So what we do are annual PSA checks. We recommend annual PSA checks, which again is a blood test and a digital rectal examination. The combination of these have been shown to be beneficial for prostate cancer screening. So that's what it consists of.
Okay, thank you. In the little time that we have left, this is so much information in such a short time, but I did want to ask you about the symptoms of prostate cancer.
Yeah, and that's a very good point, and that's why we do prostate cancer screening, because actually patients with early stage disease do not have any symptoms of prostate cancer. It's usually when they have advanced stages of disease that they present with symptoms of prostate cancer.
Okay.
That would include bony pain in the pelvis. It could include blood in the urine. So again, the important point is that if patients usually have symptoms of their lower urinary tract, it's usually benign prostate condition, whereas prostate cancer usually is, patients usually do not present with symptoms in the early stages.
The blood test, and then there's the actual, and I don't want to call it a procedure.
Well, sure. So with the screening consists of two parts, the blood test and also the digital rectal examination. And the blood test, or the PSA blood test, if either the digital rectal examination is abnormal or the PSA blood test is elevated, then it would be suspicious for someone to have prostate cancer. If that's the case, then they would require a biopsy of their prostate. And that procedure is done in the office, usually well tolerated, and that leads to the diagnosis of prostate cancer, and that's how it's diagnosed.
Okay, and the minute that we have left, or 2 minutes that we have left, again, want to give your contact information.
Sure. You can contact us at Lawrenceville Urology. You can go to our website at www.lawrencevilleurology.com. Our phone number is 609-895-1991. You can also, if there's any questions about any research trials that you have, you can also contact that number. And you can also go to the Capital Health website at capitalhealth.org. And just also to mention, again, with the Men's Health Week on June 21st is the Run for Dad with the American Cancer Society at Mercer County Park. That's a Sunday, and we encourage everyone to come out to help support prostate cancer awareness and the Run for Dad with the American Cancer Society.
Right. Again, I want to thank you for coming out tonight, and we definitely will have to have you back, because we did not cover all of our questions. But this is a very serious disease, and we need to deal with it head on.
Correct.
And men, not be afraid to go to the doctor, and I will be having my yearly physical, and so this has been In the Public Interest, connecting healthy communities with Capital Health. Thank you for listening to us live on WIMG 1300, worldwide at WIMG1300.com, and on WZBN Mercer TV 25. Capital Health, Minds Advancing Medicine. Have a good evening.